Hi, my name is Ashley, and today we're going to do a assessment of the GI and renal systems. So you want to have your patient laying on their backs with their knees bent and about 35-degree angle with their head up and their hands by their sides, as this gives you a good visual of the abdomen. You're going to start with inspecting first. When you're doing any type of assessment, you want to inspect or look, listen, and then feel. So at this time, I'm going to note that there are no pulsations, such as aortic pulsations in the abdomen, no hernias noted near the umbilicus, and there is no scars on the abdomen, indicating that there is no prior history of past abdominal surgeries. Next, you're going to auscultate the bowel sounds. So I'm going to start in the left lower quadrant. Okay, and all four quadrants are active and bowel sounds are present with normal active bowel sounds. I'm next going to auscultate for vascular sounds, listening for bruits in the aortic area and also listening for bruits in the renal area. So I'm going to start with the aortic area. And if you go under the rib cage, that's about near where you would hear the renal vascular sounds, and no bruits noted. You're then going to move on to the iliac crest and listen in that area for bruits. And you will also listen in the femoral area, and there are no bruits heard. So now I'm going to move on to palpation, and you should begin with light palpation and then move to more heavy palpation. So you use your one hand and just the tips of your fingers, and you want to note for any guarding or grimacing in the patient's face. So I'm going to palpate. Do you feel any tenderness in your abdomen when I do this?
No.
Okay. And there's no... Well, now I'm going to palpate harder. So I'm going to use two hands like this, and I'm going to go a little bit deeper, and this will help you feel for any masses.
What are you doing?
And if you feel on the right hand side, you can feel the liver, or you shouldn't feel the liver. It should be non-palpable and non-tender. Is it tender here?
No.
Okay, and then if you go on the left side of underneath the rib cage, you can locate the area where the spleen is. And is there any tenderness there? No. Okay. Next, I'm going to listen to do percussions of the abdomen. So I'm going to get my tape. And you're going to tap with your finger all over the abdomen, and you should feel or hear tympanic sounds. Okay, and the abdomen sends tympanic, and down near where the intestines are. If it was more dull, that would indicate that there's stool there. I'm now going to percuss the liver. So I will start at the breast and I will mark this area. Okay. And okay, so about right here is where the sound changes. And then you're going to want to measure it. I'm going to use this ruler. And it's about 8 centimeters, which is within normal limits. Anything between 8 and 12 centimeters, mid-clavicular line, is normal or within normal limits. And you can also do the same with the spleen. You can locate the spleen between, or normal location of the spleen would be between the 6th and 10th rib. And any dullness over the spleen would indicate that it is, or dullness noted over the spleen would indicate that it is not enlarged. I'm now going to have you, or I'll keep you laying flat, but I'm going to percuss the costovertebral angle tenderness. So I'm going to thump around where your kidneys are located, which is around the 12th rib, and you're going to note for any tenderness there. Any tenderness noted? Okay, so there was no tenderness. And if there was tenderness, that could indicate pyelonephritis, which is a kidney infection.